world is battling against COVID-19 since last 5 months, with medical professionals along with the police forces acting as a frontline warriors as well as last defenders against the pandemic. Till now, with more than 5 million people got infected with 300,000 plus casualties. Formed in 1948, WHO is acting as a backbone with an objective of the attainment by all peoples of the highest possible level of health, is working in most efficient ways and best evolved practices across globe from its member nations. These practices of treatment, along with the contact tracing and social distancing, are essential to contain the pandemic. As members of WHO, each nation is eligible to exchange ideas and research on public health and hygiene, access the latest information on disease outbreaks, and share the latest development on new vaccines. But that's not the case with Taiwan. With the arrival of communists in power in mainland China, ROC was pushed to the island territory of Formosa, also known as Taiwan. With elected president in 2000 and 2004 openly backing independence, alarmed Beijing, which led to the passage of anti-secession law, which states China's right to use non-peaceful means against Taiwan if it tried to secede from China. Later relations improved but further take a dip with the winning of Taiwanese Democratic Party in 2014, opening the debate of independence, with Beijing resorting to the exclusion of Taiwan from various bodies. Since then, Taiwan is still effectively locked out of membership in WHO as well as in various UN bodies because of the resolution adopted by UN General Assembly in 1971, which states that mainland China is the sole representative of whole China, including Taiwan.
Will the WHO consider Taiwan's membership? I want to see if you can comment a bit on how Taiwan has done so far in terms of containing the virus.
Well, we've already talked about China, and when you look across all the different areas of China, they've actually all done quite a good job.
With no clear reports about the outbreak and its mode of spread by WHO, whole world has left in dark room with no information coming out from China, and it relies only on its official briefing. With growing concern, Taiwan tries to reach WHO at the earliest, but it all left unheeded. Press releases from Taiwan CDC shows the detail putting out in public domain mentions about a pneumonia outbreak and its transmission. It has been able to effectively contain the pandemic with just 65 active cases from a total of 440 cases, without resorting to any draconian measure. Its cases were merged with China's tally, and nothing has been shared by WHO about its successful implementation of the model. The growing global outcry of gross underreporting claiming China's information because of its initial cover-ups and its continued suppression of independent reporting led to the adoption of resolution for independent investigation. Despite this, China shows aggressive behavior in its diplomacy with trade threats to Australia. Taiwan was more prepared for the coronavirus than any country, despite to its economic and geopolitical close proximity to China. But it seems that WHO puts politics first. Given the change in the affairs at WHO Executive Board with the appointment of India, India gets caught in the US-China spat over Taiwan's status at WHO at a crucial timing given the recent posture of aggression shown by the China along LAC.